Good evening, everybody. Thank you so much for joining us in our monthly health education classes. Today's topic is going to be about poison control. So, what to do when your child eats or drinks something they're not supposed to. Just a reminder, we have our healthy education classes once a month. So, if you want to know more about the next upcoming meeting as well as the topic of the meeting, you can always follow us on Facebook or go to our website. We're under Parkland Community Health Plan, and please feel free to share this information with your friends, with your family, with a neighbor. Not only is this health education classes for our members, but it's actually for the community. So please feel free to share that information with anybody that may need that information. And then also don't forget to give us a like on Facebook. And for those that were not able to attend the meeting today, we actually will be recording this meeting and put it on our YouTube page. So please go to YouTube, follow us, give us a like, so you can learn a little bit more about the different health education classes. And our guest speaker today is going to be Miss Vania, and she's going to give you some really helpful resources regarding poison control. Go ahead, Vania.
Yeah, thank you so much, Anna. Like Anna said, my name is Vanya Tao. I'm a public health educator for the North Texas Poison Center, and today's presentation is called, Of Course My Home is Poison Proof, or is it? So we'll go over, how we can use the Poison Center as a resource and other things that you may not realize that are poisonous in your own home. So I always like to start out my presentations by asking or by telling y'all what's a poison. So, a poison is any substance that can make you sick, hurt you, or even kill you if it gets in your body in the wrong way or in the wrong amount. And the key words are the wrong way or in the wrong amount. Um, at the Poison Center, or in Texas, we work as a Poison Center network. Why? Because we have 6 poison centers. We do everything bigger and better in Texas. And so we have 6 poison centers all over Texas. We have them in Dallas, Amarillo, El Paso, Galveston, Temple, and San Antonio. And so we all work together to answer the calls for the state of Texas. But all over the United States, we have about 55. And so that 1-800 is a national number. So it goes according to your area code. So let's say, for example, I'm calling and someone from Amarillo answers the phone. It's okay. It's the same thing. We'll provide the same information. But more specifically, at the North Texas Poison Center, we're open 24 hours a day, 7 days a week, where we provide information and consulting services for everyone in the community, which includes, people like me, police officers, doctors in other hospitals, clinics, really anyone who calls the number, we're able to help them out with any questions they may have. At the North Texas Poison Center, we're located at Parkland Hospital in Dallas, and our phones are staffed and specially trained in poison information. So we have licensed nurses, licensed doctors, and licensed pharmacists who go through months and months of training in order to help you whenever you call the number. And then as far as educators, we have 2 educators, me and Liz. And we serve 42 counties, which is comprised of North Texas, which is about 8 million people. And so we go and travel pretty much all over. We go as far as north from to the border of Oklahoma, as far east to the border of Louisiana, down south just above Waco, and then out west just before Wichita Falls. So we cover a lot of ground here in North Texas with poison education and awareness. More specifically, our specialists have access to a software, or not a software, but a system called Micromedics, and it's a computer listing that has over 1 million products. And so let's say I'm calling about an allergy medicine that's brand name Equate from Walmart. They can look it up and they can let me know information about that specific product. And so they have access to that. And also they provide consultations for all doctors and stuff like that, because we're considered the poison experts. And so we have access to the most accurate poison information, current information. And so it's really, really good to know that that resource is up to date and accurate rather than using Google. So each year, the North Texas Poison Center handles more than 100,000 calls. Some of those calls include 45,000 of them include human poison exposures. 26,000 of them requests for toxology related information or pill identification. And then 2,000 of them are medical toxology consultations. And then 600 of them are community education programs. And then we were able to reach 66,000 people with vital poison prevention information. So we do a lot of work, a lot of boots in the ground work here at the North Texas Poison Center. But I want to tell you about when to call the Poison Center because we are a great resource. So we call the Poison Center if there's been a poisoning, if you're concerned about a possible poisoning, to ask a poisoning prevention question, to ask for poison prevention materials or education program in your community. So some people, I mentioned Google a little bit ago, and why don't you just Google it? It's very easy. Everyone has access to their phones, to computers, and so everything that you may have a question is just one Google search away. But sometimes that's not the case when it comes to poisonings because the internet can have inaccurate information. Some websites may not contain the most up-to-date information. So for example, if I look up, what should I do if I, for example, drink something that I wasn't supposed to, it may tell me to throw up. Um, if I called the 1-800 number, they would tell me not to throw up. And so that's an example of inaccurate information. And it's just easier to dial 1-800-222-1222 than it is to type, are those little packets you get in new shoes poisonous? And so you're actually getting someone who knows what to do and can tell you what to do if there is something that you have a question about in regards to poisons. But more specifically, over half of our calls are parents calling, oh no, my kids got into things that they're not supposed to. And so why do kids get poisoned? Since most of our calls are just kids potentially eating something that they're not supposed to. And so kids are curious. When they start walking everywhere. They put everything in their mouths. And also, they like to imitate mom and dad or brother and sister. They have immature taste buds, and so they may think that the soap that they got on their hands is the best tasting thing they've ever tasted. But to adults, we know that that does not taste good. And also, lookalikes. Lookalikes can even get adults confused as well because there are some products, cleaning products, for example, look so much like juice. And so we'll see in the next slide how that, oh, no. So it kind of goes in the question, do you think or are these poisons in your home? And so some of us may have little kids in our homes and we may have just these products out and about. And here's some of them that may be laying around in your home in common areas. So we may have cleaning products in the garage. That's easy access for kids to grab it and possibly do something with it. In the bathroom, we may have our medicines laying out and they may think it's candy. Same with deodorant and stuff like that. In our garage, we may have paint. Paint is highly poisonous to humans, and so we may have that laying out in the ground, easy access for anyone to open it, and or for little kids to open it or put their hands in them. Now that it's summertime, I was going to say spring, but summertime, we have the weed killers out, the fertilizers in order to make our yards green and pretty. And those are highly, highly poisonous to humans. And, pest control things and stuff like that. I know I have that in my home and we have to keep it away, stored away in the garage because we don't want that spilling in the garage floor or anything like that. So those are highly poisonous. Even in our laundry room where we wash our clothes, Tide Pods, um, are super, super poisonous. They're highly, highly concentrated in order to wash a lot of clothes, but they're so small. And they are really colorful and smell really good. And so to a kid, that may be something that they may think tastes really, really good, but there have been cases that where kids do consume those pods and they end up passing away from consuming those pods. And so it's really good to put it away or up in a place where the kids can't reach it. Same with cleaning products. If you see here, um, these cleaning products look like juice if you turn them around and only see the directions on the label. And so we keep them under the sink, but that's always not a good idea um, because kids have easy access to that when they start walking and crawling and opening doors um, and when they see it. Same in our bathroom. Mouthwash, medicine, soaps, all these things are just common things that we may have in our homes. Even in our purse and bags, makeup products, hand sanitizer, nail polish, even medicines, those are really harmful too. If it's not intended for the person, then it can be really harmful to them. And in our garage as well, um, we have all these nice products that kill bugs, gasoline for your car, motor oil for your car, and stuff like that. Oh, those are highly, highly poisonous to humans, and it's best to just keep them up and away and stored in a safe place to make just to make sure no kids have access to them. And so here, I don't know what happened to the other slide, but that's okay. But I wanted to talk about safe medicine disposal. It's important to talk about that because people may have expired medicine or medicine that they don't take anymore. And a lot of people have asked me, well, where do I dispose of them? You know, you can always go to your local pharmacy and ask them if they are taking expired or unused medicine, but you can actually do it at home, and here are some ways to do it. So you can mix it with something such as used coffee grounds or kitty litter if you have cats. Place it in something that can be sealed, like a Ziploc bag, um, or you can use a margarine container, Ziploc top plastic bag, throw it away in your trash can, and then you always protect your privacy, remove any of the labels or anything like that. But it's easy as that. That way you avoid throwing it down the sink or down the toilet. You can just easily put it in those things and throw it in your trash. If your local pharmacy isn't taking any unused or expired medicine. I also wanted to talk about child safety locks. Child safety locks are really good in order to make sure that cabinets that have cleaners under the sink or easy access for kids to open are good. So here's one that uses a magnet device. I'm sure prices can vary, but you can easily get them on Amazon or Target, places like that. This one's a really good one because you can actually hide that magnet part that opens the cabinet. That way that your kid doesn't figure out what you do in order to unlock the child locks and then open the cabinet, because kids are very, very smart when it comes to figuring out how to open things and get to the things that they want. So I wanted to go over some first aid for poisonings. It's important just to know what to do for different types of poisonings and how to use this as a resource as well. And so if you have swallowed a poison, you should immediately call us and we'll let you know what to do. Because poisons get in our bodies in a lot of ways, and one of the ways is our mouth, and so you have to call us immediately. If it's an inhaled poison, immediately get the person to fresh air. A lot of the times, if there are fumes, if you're cleaning, or something that an example I always use is carbon monoxide. Um, just going outside and getting fresh air usually does the trick. Avoid breathing the fumes. Open the doors and the windows wide just to get fresh air in, and then call us. But of course, if the person is not breathing, you start CPR, or if you see, that they're getting unconscious or anything like that, definitely get medical attention. But most of the time, if they are able to talk, to breathe, but they're feeling funny, get them fresh air. That most of the time does the trick. Poisons on the skin. So, if a poison gets on the skin, definitely remove contaminated clothing. You flood the skin with water for 10 minutes, and then gently wash with soap and water and rinse. And then call us to see what we need to do depending on the poison that gets on the skin. And then if poisons get in the eye, definitely flood the eye with lukewarm water for 15 minutes. And if your child is wiggly and squirmy, just kind of make them sit down under the shower and just make sure that the water is just running down their eyes with their eyes closed, because sometimes that does the trick, rather than having them keep their eyes open all the time to get the water in. And then have the person, if they can't keep their eyes open, make them blink as much as possible while doing the eye flooding, but don't force the eyelids open. Don't use any eye drops. Then make sure to call us just to know what the next steps are. So we're almost done here. So even if you want to ask questions, you can call us anytime. We're a really great resource. We're open 24/7. We're a free service, and we also speak over 150 languages. And so we're really there just to make sure that everybody is safe. And so it doesn't have to be a medical emergency to call us. Some examples are, can I mix these two medicines together? Or I'm taking this medicine, but I'm also taking this vitamin. Can I take them together? What's going to happen? Drug interactions are a huge thing. I want to say that's our second most, or just medication related calls are our second biggest categories of calls that we get. Another one is, how can I safely clean up a broken fluorescent light bulb? That's a really good question. We'll be able to answer that. And then another one would be, would you send me some poison center magnets to share with my neighbors? It's always good to have the number on your fridge because you never know when you're going to use it. And so lastly, um, you should be sure that your home is poison proof with everything I explained. I know that in my home, I have to keep things covered and stuff like that when I have people coming over, because yes, I teach all about this, and yes, I'm aware, but I have to make sure that I have to keep my home safe whenever I have other people coming over. And so I want to take some time to answer any questions that you may have with this. So if you have any questions, concerns, you can always call us. We're always free. We're always there for you. So thank you.
Thank you so much, Vanya, for taking your time in presenting for us. Thank you for all the helpful information. The numbers listed on there for poison control, poison help. But of course, if anybody has any questions, feel free to call. Save this number on your cell phone. Make sure your family member saves it on this cell phone, because you just never know when you may need to call. But I want to thank you so much as well for taking your time. As always, this healthy living session will be recorded and also posted on our YouTube page. So please feel free to go view it. Leave us any comments, any suggestions of any other future topics you may want to learn more about. But if you have any questions, always feel free to reach out to us. You can reach out to us by following us on Facebook or going to our website. Our contact information is listed on there. And I want to thank you one more time, Vania, for taking your time and being here with us tonight. Thank
Yeah,
you so
thank you for
much.
having me. Yeah.
Thank you.
Mhm.